Everybody. I was just working on a presentation that I'm giving to the Western Connecticut Area Agency on Aging, and I thought I'd share a little bit of you because I just came up with some pretty cool ideas. And so if you're going to go to the talk, maybe you don't want to listen or watch or whatever you're doing, but if you do not plan to go to the talk, this is something that you could just take with you. So I was a big Letterman fan back in the day, so I'm going to do my very best to imitate Letterman here if I could figure out how to do it. I want to share my screen with you if I possibly can, but right now I'm having a heck of a time trying to figure out how to do that. So let me figure this out for a second, and it does not seem to want to let me do it while I'm already live. I don't know why. So if I go here, that's not going to work. Anyway, okay, so what I've been doing and what I've been working on is basically the top 10 reasons that service systems fall apart and top 10 reasons why we as family need to be more encouraged to stay involved and put pressure on the service systems. So the number 10 reason that service systems fall apart is because caregivers and families and everybody in the world burns out. We get burned out, we get tired, we get apathetic. I'm going to expand on all of these at a later time, but that's number 10, caregiver burnout. Okay, number 9 reason that systems in policies and whatnot fall apart is that we have this lack of ongoing commitment from home care providers or all providers in general. Again, as I just said, people become apathetic. So as they get more burnt out, they're not taking care of themselves, they get more apathetic about the people that they're supposed to be caring for. That goes for everyone, including you, family members. Number 8 reason that systems fail us is because we're too used to applying a cookie cutter approach. In other words, every case is treated the same. We treat A like B, like Z, like E, like D, like L, etc. Can't be done. Not going to work. Number 7, there's lack of consistency. For instance, lack of consistency with engagement, lack of consistency with following policies, lack of consistency with the application of principles and basic rules. That's another reason. And number 6 reason that systems and programs fall apart is because of a lack of communication. This is a biggie. We're going to talk about this ad nauseum, and it's always an issue that comes up, but suffice to say, communication is a huge issue. Number 5 reason is that we fail to stay on top of cases enough and follow them through the progression and the continuum to see where people are cycling in and out of institutions and in and out of facilities and being arrested, being incarcerated, going to psychiatric institutions or emergency rooms. And what is the reason? What is the reason, more specifically, why these recidivism rates, why this recidivism keeps happening? You heard the cash register there. A lot of times, another reason that systems and programs and whatnot fail is because simply we are putting too much emphasis on cash over caring. Just no two ways to say it. Things are just too economically driven these days. And next, we've been too prone, we're too likely to take a reactive approach. We always want to react to things that are happening. In this world of mental health, it seems like we're never out in front. We wait for it to hit the fan, and then we respond in kind. And let me just tell you, that is the most ineffective and inefficient use of resources that we could possibly have, is when we are just in constant state of putting out fires, right? Okay, next, lack of care coordination. You know that this is my bailiwick. This is my the thing that I think is most important for all of us who are in the area of caring for another person or anybody else for that matter. We need to step up We need to assume a leadership role, and we need to become leaders and care coordinators. And finally, the number one reason that systems and issues fall apart, and the number one reason that treatment plans and people fall apart in the community, causing these recidivism rates and whatnot, is lack of family involvement. And this is not to say that you don't want to be involved. This is to say that perhaps you're not allowed to be involved, or this is to say that perhaps you don't know how to get involved. And that's what we do here in this group. That's why we're all here together, so that we can all stay involved with each other and lend each other support where we need it. So lack of family involvement, I've identified as the number one cause of systems failures, program failures, and planning failures. So anyway, till next time, again, that's a little spoiler alert. If you're going to go to the talk that I'm giving on November 7th at the Western Connecticut Area Agency on Aging, that's one of the things I'll be mentioning to the audience. But anyway, have a good day. Glad that some of you can make it. I see Hayden is there. Hi, Hayden. Good to see you. I just jumped on here and did this completely spur of the moment, so I wasn't expecting anybody to be here, but it's nice to see that you're here with me. Take care, everybody. See you next time.